All right, guys, Dr. Nikrivon, are there any direct correlation between obesity and ejaculatory volume? The literature says, of course, if you're obese, you have more risk. But what obesity does, obesity decreases the circulatory blood to the genitalia, to the prostate, therefore weakening your erectile function. Therefore, it can weaken your ability to sustain a good erection through intercourse, hence getting you less stimulated and also losing your erection during intercourse. So obesity is not good because the heat that is generated damages the testes, and that can lead to drop in testosterone, therefore decreasing the blood supply to the genital region, and then therefore decreasing your erectile potency, and then psychologically affect you, and then you may not get that peak desire to get the ejaculation, period. It is very common to get a guy very excited, and when they get very, very excited during intercourse, they can have a lot of ejaculatory volume versus a very minimal ejaculation based on a very low ejection and lack of excitement. So therefore, the more potent the erection, the more excitement, the better hydration will give you a much better ejaculatory volume. Question I get asked frequently when guys go on testosterone: is regular ejaculation or intercourse better than ejaculation intercourse once a month? Yes. Regular ejaculation, regular intercourse helps improve the seminal fluid. And that's very important. They always say, don't use it, you lose it. Exactly. So if you have routine sexual intercourse and ejaculation once or twice a week, you will continue to maintain good ejaculatory volume. Of course, if you have several sexual intercourse ejaculation per week, what happens is your ejaculatory volume can decrease, especially if you're older. So regular sexual intercourse can help ejaculatory volume maintain its course as long as it's not excessive. Great question. Can excessive heat, use of sauna, affect ejaculatory volume? Maybe indirectly. High temperature and sauna and spas can affect testosterone, because when you immerse your body and your testes in a very hot temperature environment, you actually cause damage to the testes for prolonged periods. There were studies about this many years ago. So regular use of saunas and spas can have an adverse effect on testosterone. If your testosterone level drops, your erectile potency and libido can go down. And if the erectile potency goes down, you may not get stimulated. Therefore, you may not get aroused as much during intercourse. Therefore, secondary, you can get a decrease of your ejaculatory volume. So it may have an indirect effect, but not a direct effect, okay? What is the impact of alcohol on ejaculatory volume and your prostate? Alcohol blocks a very important hormone from the kidney's function. That hormone is called ADH. ADH is made in the posterior pituitary, hypothalamic tract, stored in the posterior pituitary. That's called antidiuretic hormone. When you consume alcohol, alcohol blocks the function of that hormone on the kidney. Therefore, you notice when you drink, you just peeing, and your pee becomes actually quite clear instead of being yellow. Yes, you're losing body fluid. And guess what? Your ejaculatory volume for your performance will be impaired. So guys, if you want to improve your ejaculatory volume, it's not recommended to get drunk and get wasted, because your ejaculatory volume and fluid will be at a disadvantage. But also, testosterone can be damaged because alcohol is direct poison and toxin to your testes. Therefore, consumption of alcohol is not a good thing when it comes to men health and ejaculatory volume and testosterone. I hope that answers that question.